Hi, everybody. Thank you so much for joining us today. This is a wonderful opportunity for us to get together and chat about a lot of important things related to taking breaks. My name is Dr. Sadia Akhtar, and I'm the Senior Associate Dean for GME Wellbeing at the Icahn School of Medicine at Mount Sinai. And today we're going to talk about Give Me a Break, Reframing Breaks as a Clinical Skill in Emergency Medicine. I am so honored and privileged to be joined by my wonderful colleagues here today that represent, as you can see, a wide variety of institutions, experiences, roles in the well-being space. And we really want to make this very interactive. Whoever is here to join us, please feel free to put your questions or comments in the chat. This all actually really just started from a conversation that occurred in our SAM Wellness Committee meeting regarding breaks. And hopefully, if you haven't already, perhaps this is just to let you know that we actually have a Pulse article on this. This was in our January-February 2025 issue, which was Wellness, Culture, and Equity in Emergency Medicine, Key Conversations Shaping the Future. So thanks for joining, and let's get started. So I'm going to go ahead and stop sharing my screen because I think it's important to see everyone. And, I think there are a lot of different things that we can talk about breaks. One of the most important things to understand is that we would love to have the ideal break where we can go away from the actual atmosphere that we're working in, take an hour long, maybe nap, maybe walk around the building, et cetera, and come back. But, obviously we do still need to take a break somehow. And hopefully by the end of today, there'll be some things that you've learned that will hopefully benefit you and the people that you're working with in the emergency department. So I thought, let's start off by talking about what's getting in the way. What are like some of the cultural or structural barriers to breaks? Maybe perhaps, Vitas, you can start off with that and let us know. And as I said, as you're speaking, please introduce yourself. I know the slide represented many different wonderful people.
Hi there, I'm Vitas. I'm one of the assistant program directors at Stanford University. And, thanks for calling on me. I think I have a unique perspective and that can kind of help frame our conversation because I wasn't a trainee too long ago. And now, kind of finding myself in the residency program leadership side of things, I kind of, find myself sometimes questioning if I'm a part of the problem that I was once trying to beat. As a trainee, I very distinctly remember like that I rarely took breaks during residency, not because I didn't need them, probably did at some points, but because I felt like the workflow and maybe even the culture just didn't support it. I'd worked incredibly hard to get to that point in training, and I didn't want to be seen as less committed or not gritty enough for the job, or that I wasn't prioritizing my patients. And I remember distinctly I had like a GI illness one time, and I kept having to run to the bathroom, and I was like, this is the time that my patient's going to have another seizure and get intubated, and I'm going to be nowhere to be found. I'm sure we've all had that experience. And so, I remember just, thinking that no one really said it, but the messaging was clear. And I kind of internalized it that not taking breaks meant being tough, meant being a good ED doc and being committed to the patients. And, I took pride in not needing that rest. And sometimes I'd see other residents step away for a breath of fresh air or a snack and notice some people would, a senior resident would roll eyes and, maybe have some quiet judgment. And that kind of propagated that behavior, but it also reinforced my behavior. By my fourth year, I was a little bit crispy about that and kind of looking at, the other health professionals in our department, like nursing, and thinking like, how did we figure out a way that they could safely take a mandated break, and that we are still kind of running this rat race and kind of questioning that. But now fast forward as an attending and as an APD, I find myself kind of propagating that culture still. I don't do a good job of taking breaks. I don't model the healthiest behavior sometimes, encourage, promote well-being or balance in my own life. And I find that I kind of propagate these same behaviors. And I think like where it gets really complicated is I call it kind of in my own words, this adulting dilemma where, I often encourage my residents to come fed, come caffeinated and ready to go on shift. Pack a lunch. I always recommend they should pack a lunch that's easy to eat on shift. And why? It's because I've worked in the community in a single coverage ED with 12-hour shifts. And if I didn't come well fed, well caffeinated for that shift and have a lunch pack that I could easily devour in between patients, I was going to die. That shift was going to eat me alive. That was going to be a long 12 hours, right? And I know that that's waiting for them on the other side once they graduate. And, sometimes I struggle when like a resident will want to go grab breakfast or grab a coffee, an hour into their shift. And I'll be like, well, tell me more about that. Were you like unable to get that there? But then I feel like sometimes it's misconstrued too, that like maybe I'm propagating this poor break taking behavior of like that you shouldn't leave shift or you shouldn't leave your patients to go take care of yourself. And so I find myself in this dilemma of how do I prepare residents for the reality ahead while also still supporting, like, fostering, I guess, a really healthy and well environment for them to succeed during training. I think some of that comes to systems issues, and it's a larger problem. It's a bigger problem at large, but I find myself sometimes wondering if I'm propagating the problem that I was once trying to solve.
Well, I really appreciate that perspective, especially since your role is APD, because obviously that comes into play, sort of like setting the stage for the residents. And I know, Maria, you had some experience with like affecting change at the departmental level in your role in the well-being space.
Yeah, I'm Maria Morera. Thanks, Sadia. I'm at Denver Health and I'm the Director of Professional Development and Wellbeing for the Emergency Department at Denver Health. And really, in order to try to sort of operationalize breaks and really try to standardize them and support them a little bit more, I was trying to create a plan of how to do that. And I brought it to the faculty, and it was very interesting because Vita, some of what you were saying, true of the faculty too, right? So there was some of the barriers that came up from the faculty and the concerns that they voiced was one, there's this sense of duty, right? That you don't want to leave the department. You're afraid that something is going to happen and then something might go wrong. And you don't want to sort of miss it. You want to take care of your patients, right? Additionally, there was some nervousness about sort of mandating breaks or being too prescriptive with breaks that as some people felt that might just stress me more. And then there was also people felt, well, that's only going to move my work, right? It's just going to sort of move the work to later on, which means I'm not going to get out of the department right after my shift. So all I'm doing is postponing that work, and I'd rather just keep working and being able to leave when I'm done. And then there's also this question of resources. What happens, right? With nursing, we know that when a nurse takes a break, there's another nurse that comes and takes over their work. And, that was sort of the question that came up. How do we do this? And initially, the plan was to kind of just maybe change around where we, how we room patients and have nursing support in helping us take these breaks. But people felt like it might be better if somebody else came on, but then you have to do another sign off. So then that adds another level of complexity, right? So there's all these different things that came up. And that was some of the concerns. And I think the big thing is really we sort of, it's kind of in our Hippocratic oath, right? We sort of put our patients above ourselves. And we forget that sometimes though, we're not at the best when we don't take these breaks. And that actually will help us to put our patients above ourselves at other times. And so it's finding this balance and really changing the culture and changing the behaviors. So we're planning, we've had a group get together and we're planning on sort of how we're going to trial something to see how it works. But I will tell you, I think unless you have a process and you operationalize it, it's just not going to work. People are going to do it in different ways. And unless you put it into the system and you say, this is normal, this is what we should be doing, and it's the best for our patients, I think it's going to fall apart.
Well, I really appreciate that perspective because I think from a department standpoint, it's really important to obviously, as you're saying, find out what's going on that's preventing people to taking those breaks. And as we all know, data is extremely important, especially I would say in the well-being space. You have to have numbers to hopefully, you can able to convince people. And I know, Wendy, you've done some research about this. It would be really interesting if you could share what you've learned from your study.
Yeah, thank you, Sadia. So my name is Wendy Sun. I'm the second year administration fellow at Yale, so just finishing up my fellowship currently. So we actually did a survey study serving over 13 residencies with a response rate of 72% across, residencies that had both 8-hour and 12-hour shifts and residencies that were academic, county, as well as community sites. And what we found was exactly kind of supported what Maria and Vitas have said so far, that we are really bad at taking breaks. Like we put our patients' need above our own and not necessarily focusing on what you think about like Maslow's hierarchy of needs, even our basic needs of, that food and, hydration. So what we found was that among respondents, around half of residents didn't take any breaks to eat during their whole shift, and less than around 1% took more than 20 minutes to take a, break to eat. And so what we found is that there's a huge gap and an opportunity for us to really make an impact and to help decrease burnout by addressing our, our basic needs on shift. And I think, Maria and Vitas touched a little bit about this already, but when we looked at, the top three barriers that our respondents said in terms of, what's preventing them from taking breaks, competing priorities such as new patients, charting, definitely contributed to a resident not taking that break. And the culture also was an important contributor to that. And what we found that was really fascinating on our qualitative analysis of what people wrote to us was that they really, if someone asked them to take a break, they would have been happy to take the break, but because there wasn't like a precedent set or they didn't feel comfortable or felt judged that someone else might think that they're taking a break, they're less inclined to take that break. But if, an attending said, go take a break, respondents felt like they were more likely to do that. So I know, we have more colleagues on our webinar today who will talk about how we can combat this and how we can move together as a specialty to encourage this break-taking behavior.
Well, again, I just want to commend you for doing that study because we need information and we need hard data to really help us get a better understanding and obviously trying to convince the people that hold the purse strings. So I really appreciate that. So now that we've talked about what we already know, the challenges of how, one can take a break and why they are not doing that, let's pivot over to solutions. I think it's a great opportunity. Like I said, we've got so many different institutions represented here, a lot of people with different backgrounds and their roles right now. And so let's talk about solutions, things that we can do. And I'd like to really just start with maybe Vicky. Do you want to share what's been done at your shop and how you can actually share maybe some best practices?
Yeah, absolutely, Sadia. Hi, my name is Vicky Zoe. I am one of the current APDs at University of Vermont in Burlington. And I want to piggyback sort of off what Vitas was talking about earlier that, a lot of the behaviors that we saw when we were a resident. And I was fortunate to have a particular APD actually who always, at the beginning of the shift, made it one of our goals that during the shift we would actually take a real break. And she defined a real break as giving her or one of our other senior residents your work phone so that if you had any incoming messages or calls expected, that you were not taking that call during your break. And that break involved leaving the emergency department, obviously not going far, but whether that be going outside the cafeteria or the residency space to physically sit down or walk around for a dedicated period of time. And I think we've talked about this a little bit with our discussion so far, but really starting the beginning of a shift with saying that these are the shift goals. And a lot of us have these conversations at the beginning, like, what do you want to learn today? What patients do you want to see? And stating as one of the actual shift goals that the dedicated break happens can really set the tone for the rest of the shift appropriately.
Well, I really appreciate you sharing that. And, after we had spoken initially about this topic, that's something that I know a lot of the other faculty members at my shop, at least, have started to be encouraged to do, to ask folks about making sure that people go on breaks during the shift. So I appreciate that. And I know, James, you've had a lot of experience in the well-being space and have done quite a different throughout your career about this. So would be really great to hear what you have to say.
Yeah, sure. My name is James. I'm an associate professor at Emory, and I'm co-chair of the Wellness Committee. And I've been engaged in breaks and the culture around it and trying to change it at our shop for quite a while. We did a focus group study with 120 of our physicians and residents a few years ago, just trying to identify the culture around it and why people weren't taking breaks. And just to reiterate what others have said, there seemed to be a culture that identified self-care with weakness and patient care and productivity with strength. And I think any effort to break down that and make sure that people take breaks needs to address those beliefs, those kind of underlying cultural beliefs in our profession. Because the last study we did, we had residents take breaks and we measured how many breaks they took, how long, etc. But one of the things that we came up against was modeling. So we've got a culture that has produced us faculty attendings that don't take breaks, and we're trying to model something for residents that's better. but it's very difficult to arrange that modeling when we don't do it. And that's been talked about before. So one of the things we've had to do is educate faculty about the reason why. Like it's not mollycoddling or, just trying to give residents an easy ride. There's very good reasons for this in terms of cognitive ability later on in the shift recovery, and productivity. So in a way, reframing it as patient care is caring for ourselves. It's the same thing. So educating faculty over and over again at departmental meetings, developing a departmental policy so that can be referenced by residents who wish to take breaks for faculty. So this is what we do. This is official. This is our policy on it. Reframing it as a skill, like I said before, and the label of this meeting is the same. A tight leadership group to model this, and me and Rohit have talked about this recently. Having 5, 6, 10 people who do it regularly and purposefully with the idea of modeling to make that number bigger over time. Just repetition of the message and then having food available. That's important. Making it easy, reducing the barriers to them actually taking a break. But it's a long process.
Well, I really do appreciate your perspective. And I think what you were just saying about making sure that food is available is also very key so that they can actually go and take the break. Having said that, I know that Julie, you've had some experience with that at your institution and your department. It'd be great if you could share your thoughts about that.
Yeah, hi everyone. I'm Julie. I'm faculty at Penn State. I oversee our resident wellness efforts, and I'm a newly appointed APD. So something that I took for my own residency was our resident snack cabinet. So we keep a cabinet within our education office. At my residency, it was in the department itself, but I kind of like it where it's not in the department, it's in the education area. And it gives a place where residents, faculty, APPs, anybody can go over, whether you're in the department, you're off service. A lot of times residents will come down, you're just passing through after conference. It's become kind of a little place where people can congregate, get a snack, and it's cool because it's just crowd funded. So we have a little donation box in there. Myself, a couple other faculty take that donation and we just kind of perpetuate it, go to Costco, Sam's Club. People really love the idea of it. There's healthy snacks, not so healthy snacks, but it's something that's nice for people to go to, and it's always there.
And I will say, as residents and fellows, they absolutely appreciate it. To just know that there's a place where they can go that they feel loved and cared for, obviously is very important. And speaking about residents and fellows, we are very fortunate today to have some yes?
There was an interesting couple questions in the chat that I just wanted to bring up. One was for Vicky, and was that break time pre-selected as to that time sort of at the beginning of the shift, or was it more organic, for lack of a better word?
Yeah, I appreciate that question because I think that we had a lot of great discussion come up in the chat, actually. I feel like it's really hard to have a designated time, like, hey, at 10 a.m., you're halfway through your shift, you're going to take your break then. We all know that doesn't work. Something's inevitably going to happen. But I think giving general timeframes can be really helpful, especially when I work all nights, as I know some of the individuals in this group do, to sort of when that lull is going to be. And it's a good time to prompt your resident like, hey, like we knew there was gonna be a little bit of a lull in patient volume between like 3 to 5 a.m. Like I think now would be a great time for you to take that break that we talked about or within the next hour or two. Other people had some other strategies, but that's usually what I go for.
Amy, any other comments or questions coming in that would be good to address now?
Well, coming in with another great question is Amanda again. This one for James regarding whether or not you got your operations or medical directors sort of, I guess, as champions before you started talking to the general faculty about this.
Okay, I was writing a lengthy reply to that, so I'll just say instead, I think in order to have the study up first, we had to have operations and the chief of service on board, and they had to visibly support it because they want things to flow in the ED and they want it safe. So we had to reassure them that operations would not be affected. We had to write that into our verbiage, and that allowed us to have the study, make the study, and also then turn it into a departmental guideline. So they're completely on board. Our chair is also on board and the residency leadership. But again, modeling is difficult. It's very hard to expect a large number of leaders to model it when they didn't learn that. They didn't learn that that was valuable to themselves. But they know it is. So even if they don't do it 100%, they will support it. They will always encourage the resident to take the break. And then over time, hopefully as a group, we can grow to the point where everyone's modeling it.
Well, really appreciate your response to that. And feel free, folks that have joined us, to drop any comments, questions in the chat. We really would love to address those as well. So, as I was saying, that we are very fortunate today to be also joined by some residents and fellows. And I think that, as a faculty member, you sort of see things only from that perspective. And what really in my well-being space, I understood that I really need to know what is important to a resident fellow. We may be thinking as faculty or as well-being leaders to do a certain initiative, when in fact that would be the least important thing for a resident or fellow. And so hopefully today, for those that are listening also to this meeting, you'll be able to get some ideas. But would love to get Maya to sort of explain about, your perspective as a fellow and perhaps maybe your residency experience too, about how breaks were occurring while you were on shift.
Sure. Hi, I'm Maya Winkle. I am the Wellness Fellow this year at Stanford, and I graduated last summer. So I have kind of the mixed perspective of a very recent resident and a fellow and someone who works as an attending on shift. So I kind of span a little bit of everything. I think some of the points that were brought up so far are very poignant. I think it's tricky to sort of encourage people to take breaks, also with the understanding that patient flow changes at different times during the shift, and you may have a very sick patient come in. Just kind of to answer one of the previous questions that we just touched on in terms of break behavior, the way that I saw it done differently by different attendings at my residency, which was in New York in the Bronx. So high acuity, kind of a crazy ED, was sometimes people were recommended, who wants to go first? Okay, we're going to have everybody take a break. Who wants to go first? And then we'll kind of just play it by ear. Or just, the encouragement, let's just make sure that everybody takes a break. It's important. And I bring that up because I think it was modeled differently by different attendings. And I think what I try to do on shift, I think I look very young. I am a recent graduate. And so I think the residents can kind of relate to the fact that I was just in their shoes. And so what I try to do is model their behavior. If I say I'm going to go and grab like a water or some snacks, can I bring some for anybody? I let people know I'm taking a break. Hey guys, I'll be right back. Or I'm going to be gone for 10 minutes. So just keep an eye on everything. Of course, if you need to reach me, feel free to grab me. But I let them know that it's normal to go to the bathroom. I'm not taking a break and, leaving the premises, but I think even just vocalizing that and saying I'm going to be gone for 10 minutes, reach me if you have any concerns, sets the tone that it's okay to step out for a little bit of time. Another thing I do is I try to encourage the senior residents. So the patients are all under the senior resident's name and my name. If there's no senior resident, I'm still taking care of all the patients. So I encourage the residents, like, you can take a break because I have the whole board in my given zone. So I think explicitly saying that, I don't know how often I explicitly say that, but I try to get that message across. Like, we share all the patients. So if you need to step out, that's fine. And don't feel like you are kind of abandoning your patients. And so that's another thing I do. I also kind of try to have them think about it as like a sign out. When you sign out your patients, you're not just sending them out into the ether, you're handing off your care. So when you take a break, someone is still caring for your patients. Another thing I do is I ask patients how I can help, whether that's during the shift or during their break. Okay, when you're on break, when you go for 10 minutes, is there anything you want me to do? In addition to fielding all the pages or discussions with consults or anything we need to do specifically for a patient, is there anything you want me to do with the thought in mind that a lot of times, and this was something that I experienced a lot during residency, was I felt like if I took a break, and this was touched on earlier, that was actually adding work for me on the back end, right? Would I stay later to do notes? Would I have to do tasks later on? Is there something I can do now that will facilitate your shift so that you're not staying later? And then I remind them probably a lot that I was just a resident. And so I understand that. This isn't, fortunately for me, fortunately, unfortunately, this isn't years away from residency. So I can relate to them and I hope that they can relate to me. And, one of the things to keep in mind also is when you're not taking a break and when you are doing these things that are not good for your care, you're so focused on your patient's health, but you're kind of harming your own. And so one of the things is, you're going to be more tired. I don't say it in this way, but the thought is you're going to be more tired if you're not taking time to eat something on shift or stay hydrated. And that doesn't, I kind of don't necessarily encourage, or I don't practice like going to the cafeteria on shift. I bring food, but that's also hard to do in residency. So there's kind of the mindset of things may be easier or harder during residency, fellowship, or being an attending, but just kind of encouraging the practice of taking a break and recognizing that it's actually good for them.
Well, I really appreciate that perspective. And I think it's important, as you were saying, like, being a current fellow, very close to the residents, even as fellows, you're role modeling, right? So it's really important in that space as well. So I appreciate that perspective. And I know, Sheridan, you have a unique perspective based on your experience. It would be lovely to share that.
Yeah, hi everyone. I'm Sheridan. I'm a rising PGY2 at Stanford, very invested in wellness as someone who's early in their career and planning to be in the field for a while. I would echo everything that, everyone has said so far in terms of the importance of the modeling of the attending for whether or not the residents take breaks or not. But I'd have a few other things to add as well. I think we've mentioned in this webinar that sometimes it's hard with departmental flow to have a specific time to take a break at. And I've definitely felt that myself, but I think to provide a different perspective, having a specific time where there's a particular event in the hospital, whether it's like the cafeteria is closing or maybe there's free food for residents somewhere, if that event happens at the same time every day, let's say like 9 o'clock, there's something that happens, I think that can actually make it a lot easier for residents to be able to take that break because everyone is already aware of it, everyone's expecting it. You can kind of plan around it in a structural way and make sure the whole team can sort of support that happening, at least for the resident in particular. I think it's a little bit different at the fellow and at the attending level. So there's one thing I've seen, and then very related, another thing that I've seen that has been really helpful is having sort of like a GI rounds. That's also like a scheduled event that can be really good for, doesn't necessarily get you out of the department, and honestly, it's still an educational activity, so I don't know if it really qualifies fully as a break, but at least you're taking a break from patient care, you're making sure you get fed. A lot of times it's a good opportunity to talk to your fellow residents and have that camaraderie, and all of those things are, very important for wellness as well. So I think those two ideas are very helpful to include in our discussions. And then the last thing I wanted to talk about too is that this break taking, as we've mentioned, is very cultural. So whether or not we take breaks really depends on just like the institution, who works there, whether we see other people taking breaks or not. And that's very true amongst residents as well. So I've had conversations with my co-residents around, do you take breaks or not? And I think a lot of them are very hesitant to take breaks for the reasons that we've already talked about. And one of the things I've noticed is people do really enjoy hearing the data. So I will be talking to people and they'll say, "Oh, I don't want to take a break because I have to work more later." But I think that when I am able to share with them, hey, there have actually been studies done that say taking breaks improves our empathy, it improves our efficiency, it can improve patient outcomes. That is very convincing for people to motivate them to find these strategies that we're talking about to be able to take the break because it is a skill. It doesn't come naturally in our world. Yeah.
Well, I appreciate that perspective, especially for someone who's a rising second year. Soon enough, there'll be interns there asking you about questions on how to really stay healthy and being able to manage residency with all the things that they have to do. So I appreciate that. And Ro, I wanted to give you an opportunity to speak about your experience and your interest in well-being. And, from a resident's perspective, what are certain things that you feel would be successful in obviously having the residents take breaks?
Yeah, absolutely. So I'm Ro. I'm one of the graduating threes at Emory. Also, one of the past chiefs this year and one of the resident reps on the wellness committee. Work closely with Dr. O'Shea. So I've kind of been on both sides of this during the course of my residency training. So when I came in, we didn't really have a culture of taking breaks, or it wasn't really discussed. And if you had asked me at that time, I think my answer would have been along the lines of, I don't want to seem weak. What about my patients? Who's going to take care of them? I don't want to seem like I'm being less efficient. And now, as I'm graduating, I've gotten to the point where I've built it into my clinical practice, and I take probably at least a 10-minute break in some shape or form per shift. And a lot of that has been cultural and just talking about this with people. For example, working with Dr. O'Shea, there's a few attendings in our program that take breaks themselves, and seeing that as a resident and understanding that as a valuable clinical skill is super valuable. I think all of us can attest to the mental fatigue and exhaustion you have on shift, and there's good data to support how significant that is, especially the longer the shift is. And the ability to take 10 minutes to yourself, not just for yourself, but for your patients, to come back with a clear mind, to be able to address those situations with a clear head, I think has pretty long and large ramifications. From a resident perspective, I think things that have worked well towards encouraging this is one, creating a culture of support, especially in, some of our zones, we have multiple residents working together. And so me encouraging my fellow residents say, hey, I got this for the next 15 minutes, why don't you step away? That culture, I think, really has helped individuals understand that this is something that we're doing and that it's okay to do and it's not inefficient and not bad to do. Similarly, like Sheridan mentioned, having that modeled by attendings. And I think the other thing to note is that, like Dr. O'Shea mentioned in our study, 80% of attendings that we surveyed during this noted no change in efficiency of the residents. So when we talk about taking breaks, right, I think it's really important, and we've been emphasizing this, that you're not changing your efficiency. You're taking a few minutes for yourself, and you can come back in with a clear head and potentially even do better for your patients.
Well, I really appreciate that. And again, it goes back to the data that all of you had spoken about. And you said something really important, Ro, which I feel is that camaraderie that the residents have in the program where they feel like, you know what, why don't you go take that break? I've got the next two patients, because I think that's the burden that the residents have, that they're not, as mentioned earlier, that they're not able to keep up with the work or that they're slacking. And so having that camaraderie amongst the residents and that culture again that we've talked about, I think is extremely important. I wanted to get some perspective also on what personal behaviors and system levers that people have been dealing with. And I know that, Amy, you've done some work in this arena. I was wondering if you could share your thoughts about how successful people can be in taking breaks in the emergency department shifts.
Sure. So my name is Amy Kontrick. I'm from Northwestern, and I am a former clerkship director, currently focusing more on research now in my career, and also a former scholar of wellness at our organization. And I'm a member of the Wellbeing Council for our health system. And so I'm someone that oftentimes will eat either before or after a shift. So I sometimes found that I wasn't needing or taking a quote food break. So it wasn't as obvious to see what I was doing. In my role so I started taking breaks, just walk breaks. I like to get out of the department, clear my head a little bit, a minute or two. If it's nice in Chicago, I can go outside. Otherwise, there are some quiet places that I've found that I can just kind of reset and then come back. And like other people have mentioned, I always let my residents know so they know I'm stepping out. And I often let one of my colleagues know, so in case the residents do get into a situation that they need some help, someone knows that I'm actually not currently present. And then in my role as clerkship director, I felt, and I'm so glad no one mentioned our medical students who spend so much time in our emergency department, but with the hierarchical nature of training, they're oftentimes watching us for what we do. And if it's not clear that breaks are okay, they probably won't take a break, particularly those who want to go into emergency medicine. So I actually did this at orientation, and I set the standard that like breaks are appropriate and expected during a shift. But like some people mentioned in the chat, it's hard to know when someone is going to take a break. And I'm not going to tell you you have to eat at 10 a.m. on a morning shift. We talked about when and how and taking breaks, but that the expectation was that whether you needed to eat or not, you needed to take some type of break and to notify, your team and everything. So I thought that was good, because then it sort of became an expectation. And so they knew that it was from the clerkship director that they had this right, that they could do this. And then I would talk to the residents on shift about this as much as I possibly could. The other thing that we haven't talked about, which I think is a break because it requires a pause in your work and a separation from the work environment, is for those ED clinicians, so nurses, residents, attendings, APPs, returning from pregnancy leave and needing to pump. And so one of the things that I had worked on after watching some of my colleagues and residents pump on a toilet, struggle to find a place to pump, and myself having to hope that I remember to get the key to one of the nurse manager's offices was when we were doing a remodel. I worked with one of our departmental leaders to develop some type of appropriate space in there that was protected, that was private, that had things that were necessary for one to be able to do that process successfully. And so I was very proud because we were able to work to get that space within the emergency department. Because as we all know, it's hard to go potentially to a public space that could be way outside of your emergency department and to do that. So that space still exists now for all of our ED clinicians returning from a pregnancy leave. And then on the systems level, I started doing some research and I got involved with the Scholars of Wellness program in our organization. And through that research, and as other people have mentioned with data, have been able to make some changes. And also having a well-being council and being a member there, been able to highlight some of the specific issues facing emergency medicine and the emergency department clinicians around breaks and other issues, and the culture of healthcare, particularly on the physician side of things for taking breaks, taking naps, and things like that. So we're working towards that. We've had an expansion in some well-being space that's available to our clinicians.
Well, I really do appreciate that perspective, especially at the system level. And I know, LA, you've had some experience at the system level as well with all the work that you've been doing on a variety of topics related to well-being. Just curious to know about your thoughts and how you've been able to sort of hopefully succeed in taking breaks.
Yeah, Alvarez, I'm the director of well-being at Stanford, and I think that personally, I love food, and I think food is my love language and our love language at Stanford. And so when I show up to work, I find it a good habit to just bring food, not just for me, but also to the residents and my colleagues. Especially, I started during the pandemic when it was not easy to get access to food, and what I realized was it would just bring people together. People would start talking to you about the food and not necessarily about the work that we're doing. So it's a nice break from work. And I wanted more of that, I think, especially when it gets really busy. I also find that it doesn't always have to be food related. For the residents here that know me, I do a lot of walk and talk because I find that if you check in with residents when they're sitting down, they're focused on their charting or focused on other things. But if you deliberately just walk around, and our emergency department is the size of a football field, by physically walking that, it actually makes people feel more open to talking about just catching up, how their life is, some struggles, some successes. And it's been a great way for me to just create that time for some coaching moments. And also gives me a break to catch up with the nurses as well. From a systems level, I think one of the key things that we were able to really prioritize as we were navigating the pandemic, the many changes that's happening with the workflow in the department, especially with the increasing volume, was really having our chair talk about taking a break at work. It sends a significant, important signal that it is important to take a break and it's okay to take a break. And also seeing my chair, my vice chairs going on breaks when they're working is also helpful to do. Another systems level effort that I was really impressed with is Dr. Maria Makowski, who is part of the Stanford WellMD Well PhD Center. She wanted to see the kind of access to food that's available for folks who are working overnight. And so she, as a PhD, would actually follow residents for, I think, for a given month and just like run around and see how busy they are. And also at the same time would try to track like what kind of food they're eating. And what was very clear was that at nighttime, there was no good access to healthy food. WellMD actually partnered with our cafeteria so that all the food that's being served pretty much during the day come like around, I believe, 9 o'clock. They just give that out for the residents to take. And so then there's access to healthy foods for those people working overnight and also those people who are finishing their shifts around 9 p.m. So it's a nice way to just make sure that there's healthy food accessible throughout the day.
And what you just said, LA, is brilliant because I think the leftover food in the cafeteria, which I'm sure there's a lot of, there's so many people that could benefit rather than it unfortunately being thrown away. So I really appreciate that. That's something definitely that I would want to look into a little bit more at our institution.
We have
So
an attending at Montefiore actually who, knowing that this exists, like he would rate, I'm not going to name him, but he's really dear to many of us. he would raid the cafeteria at nighttime and bring those food out to the residents in the emergency department because it's going to get thrown away anyway, right? And it's just again minimizing waste and also addressing the gap that already exists in the hospital.
Absolutely. I know, Amy, you were sort of monitoring the chat. Any important comments or any questions? Because I think that in the brief time that we have left, I think we have about 10 minutes more. And I know we have some folks that have joined us in the audience. So if anyone is interested in asking any questions, comments, please either raise your virtual hand or you can put into the chat as well. So handing it over to you, Amy.
Yeah, thank you. Yeah, so we had a comment or a question in the chat about whether or not folks have access to a cafeteria, in the late hours, or if it's a 24-hour cafeteria. And this person mentioned that they often have to head out to Wawa, which, having gone to school in Philadelphia, I know what Wawa is. That is your convenience store, although it is better than many convenience stores, I will say, in other parts of the country. And so just curious if others have access to 24-hour food. Our team had done a study about this a few years back, and it was surprising how many places did not have 24-hour access to food, and it was vending machines after certain hours. So just curious if others have it. There's some mention of some food trucks. Any other unique things that, other than the food rounds? And I love the idea of having the cafeteria supply some healthy food options.
Yeah, it's in our department, we had a donor give us money, gosh, probably about 8, 10 years ago now. And so we have a fully stocked refrigerator and I guess snack bins. That's now because everybody knows and is aware of it being there, including our pediatric emergency departments. We stock it many times a week because usually by Wednesday, like the food is gone. And so like now we have, I think, another stocking time around Friday, and then there's a QR code there just in case like it's really done earlier than we would anticipate.
We have so I saw Maya said that they have McDonald's, and we used to have McDonald's a long time ago. Now we have Subway. But we also, because the cafeteria is never open like 24/7, right? They always forget about the night people. They opened what's called like a Good Day Cafe. It's like a 24-hour area that's just open to the staff, and the residents can use their meal cards there. And there's like healthy options, there's coffee, there's a lot of different things. So, I mean, it's something they can use their meal. And, the way their meal cards work is a portion is for the cafeteria, a portion is for the Good Day Cafe, and they can have some say as to which portion, what they want to use it more for. But they typically have plenty of money in those meal cards as well.
I think we heard from a lot of folks that there were there was that culture of putting your patients first and, being afraid to leave, something might happen, safety issues. And then I think we heard the good counter argument, which is in fact, not taking a break is in of itself a safety issue. And James mentioned in a posting in the chat that during their study, there were no safety issues. Anything else you want to say about the issue of safety? Or I know I think you touched upon productivity as well, James.
Yeah, it's a perception. I think when we did that focus group study with 120 physicians, over and over again, people were saying people will die, somebody will die in the waiting room, bad things will happen if I go for a break. But of those 120 physicians, not one could name an actual incident of something bad happening because they were, they'd stepped away for a minute or were in the bathroom, or it seems much more of a perception than an actual problem. And the more recent study we did last summer, nobody could think of any negative patient safety incidents from the residents taking breaks, not a single one. So I think you can build in safety. You can say, we're not going to disappear for an hour. You're going to be geographically close. You're going to have a line of communication, a working phone, although I know that some people would rather not have the phone for a break, which is fine. People know where you are and you can get back quickly, and you have that sense of timing to say, okay, now is the window when I can step out. And if you do that, I don't think it's unsafe at all.
To build off the safety issue, I think something that could really be leveraged is the data, right? I think like numbers really speak volumes, especially to hospital administrators and to driving systems change. And right now, there's really a paucity of data about break-taking behavior or the benefit or risk to patient safety. And what is out there is largely related to nursing. A huge negotiation for them is that it is a patient safety issue, that more medical errors do occur when nursing is fatigued and not having breaks, and that breaks improves that. And Right now we don't really have any literature supporting that from a physician standpoint. But I think when we can tie it back to patient safety issues and have numbers to support that, I think that helps drive change.
Yeah, so I think tying that, like having a multi-prong approach, so there's some regulatory issues. There's just, it's the right thing to do to allow people to break to take care of, I don't remember which speaker said it, our basic human needs. But there is actually a lot of data out there, some in healthcare, a lot in other industries, that the risk of the mental fatigue that accumulates, particularly with outbreaks, are things like actual decreases in productivity. So that's a business side of things, decrease in performance, increase in errors, breakdown of team skills and teamwork, an increase in ethical lapses, which, one might think that's important for the work that we do. And then importantly, decrease in job satisfaction. So when we look at engagement and retention, those are really important things in emergency medicine, both on the physician side of things and also, as we know, on our nursing and APP side of things. So I think the data are there. And there's no reason to believe that if it's working in another high risk industry, that it wouldn't be applicable in medicine, or if we can see it with our nursing colleagues, it's probably going to be the same for us as well.
And just to piggyback on that, I will say that, having the stakeholders, someone had mentioned earlier, having the key stakeholders at the table is so important. So just starting off, I would say from a residency perspective, looking at how the culture is built within the residency of what actually does happen while they're on shift, and then leading it into the department and making sure that the chair is obviously being a role model in that time frame is also very important. And there were some comments about system level change. So I think there's plenty of opportunity for us to really understand that this is something that can be done. One of the most important things I think, though, is that it has to be part and parcel of what we are doing as emergency physicians. I'm sure, like for the residents, when you were looking for the residency program of your choice, you wanted to see happy residents that were getting along with each other, that were learning in the emergency department. And when we are looking for jobs as faculty, it's very important to see even these small things of like people being able to take a break. That is something that we want to really focus on, and knowing that individuals are feeling valued too. Any other questions or comments coming through from the folks that we have with us today? And thank you for joining us for this session. We really appreciate it.
I will say one other important, I think it's more of a comment than a question from Maya, was that some of this could be particularly tricky for folks who are working in a single coverage emergency department. And then obviously we had Alay's outstanding comment in response, which was all the more reason why we should be treating this as a skill and something to be developed during residency. So I think that's a great point for all of us to think about how we're helping develop this skill for our trainees.
Yeah, definitely. I do hope that today, those who've joined us, who are listening, were able to understand how we can actually conquer this issue of break taking, and understand that by us role modeling, hopefully, and taking care of ourselves, we're actually enhancing patient care on many levels. And just two sort of, key takeaway points are having the key stakeholders with you, understanding that the culture and the environment that we develop in our emergency departments are so important. Leadership definitely has to be supportive. The residency program has to really encourage this break-taking skill, as we mentioned. And we all are on a journey of trying to figure this out for ourselves. But hopefully folks have learned something that they can implement into their personal lives as they are coming on shift, going off shift, and obviously during the shift as well. I just want to take a moment to thank all of our wonderful panelists. I know that we've spent some time getting ready for today's session and really do appreciate all the expertise and the various perspectives. If we have impacted even one person today to change their behavior and really have healthy breaks during their shift, I think we've done a great deed. And so thank you everybody for joining us. I appreciate everyone's expertise and looking forward to working together in the future. So thank you.
Thanks everyone. Thanks, Dawood.